Moving on to diagnostic procedures, know that a diagnosis of peripheral vascular disease, otherwise known as PVD, is based first on patient history, physical, and routine blood tests. These are performed outside of the OR. Patients with PVD may receive further diagnostic treatments in the OR setting. Those can include Doppler technology, in which a probe is positioned over a pulse point and the sound is intensified via ultrasound so that the sound of the blood traveling through the vessel can be heard. This can be done both in the sterile and non-sterile roles, so be sure to have a sterile probe available during these procedures. It's also common for patients to receive an arteriogram, during which an X-ray is taken while the vessel is injected with radiopaque dye. It allows us to see the shape and interior surfaces to determine the location of strictures, occlusions, or malformations. Interventional arteriography takes it one step further and allows us to insert stents and other devices while under fluoro. An arterial plethysmograph uses 3 blood pressure cuffs and a pulse volume recorder to measure the arterial pulse waveform during systole to determine reduced blood flow in the lower extremities. And finally, intravascular ultrasound uses a flexible catheter inserted into a vessel for ultrasound readings to map the lumen of vessels. Beginning on page 845 in your textbook, it shows a variety of instruments and describes them by category. Spend some time covering this content because it's these special instruments that get added to the otherwise general instruments that allow us to perform these procedures. Understand that instrument selection will be based on the size of vessels being worked with, as well as the specific type of physiological problem present. As the scrub tech on the field, know that suction is preferable to sponging, as it tends to be less traumatic to the vessels, hopefully reducing the risk of damage. Know that vascular instrumentation is fragile. You must take great care of these instruments to avoid damaging their tips or causing accidental bending. Note that like intestinal clamps are to intestines, vascular clamps are specifically designed to prevent trauma to blood vessels during use. Dissection requires sharp, delicate scissors. Blunt and sharp dissections are used to gain access to blood vessels. Make sure you get your instrument book out and take a look at the Potts scissors on page 245. These are commonly used after an 11-blade stab incision has been used to create an arteriotomy. Also look at the DeBakey Bulldog on page 254, used to occlude small vessels using spring action, and the Satinsky clamp on page 257, the titanium DeBakeys on page 264, which are often used during suturing because they are not magnetized, and the Castro Viejo needle holder on page 275. Here's a continuation of some of the scissors. Those are the Potts. Continuing with the supplies and equipment needed within this specialty, it's important to know that vascular suture is a super duper big deal. First of all, it's going to be non-absorbable and a monofilament, most often a Prolene, although another option is Gore-Tex. The reason for this is we want to prevent the potential of the vessel reopening, and if we used absorbable suture, the risk of that happening would be higher. The sizes selected range from 3/0 to 8/0 depending on the vessel being sutured. These needles are always tapered and never cutting. There is a subset of vascular suture that is designed with needles that are smaller than the suture thread they are attached to. So when you look at traditional suture needles and suture, the base of the needle is the same diameter of the thread, which is fine almost all the time. But because blood is so sneaky and it will find a way out of the vessel if possible, we need to prevent that from happening. So I'm going to introduce you to HS suture. Basically, what you need to understand is that HS HS whatever number is listed in speaking about the needle directly, and the thread will be 2 sizes larger. That will allow the needle to go through the vessel and for the thread to fully occlude the hole it made. Here's an example of HS suture. HS5 is a 3/0 Prolene thread on a 5/0 needle. Okay? Lastly, these sutures are almost always double-armed. That means there's a needle on both ends of the thread. The surgical technologist must be careful while using double-armed suture. When performing the initial count, they must make sure they count all the needles accurately, not just one per package. While using it on the field, the ST must keep track of the needles and keep them safely stored in the sharps container. The ST must handle the thread gently, and when removing it from its package, gently stretch it to reduce the amount of manufacturer's memory in it. But you can't pull too much or it'll break. Additionally, it's important to note that should you be working with Gore-Tex suture, there is not out of package memory, and therefore it should not be stretched. Another new supply item for you to learn is the rubber shod. Rubber shods come in packages of 5 pairs, so 10 total, and are applied to the tips of a mosquito clamp. They are used to clamp Prolene suture, and that serves several purposes. 1, it prevents the second needle on the thread from getting lost. 2nd, it provides gentle traction on the thread while the surgeon sews. The assistant will be ensuring the thread does not tangle while in use, and the shod helps with that task. Finally, the shod is required because the small thread is easily weakened by a clamp's force, so the shod protects the thread while still holding on tight. Another supply, not listed on your slide, is the felt pledget. This is utilized for 2 reasons. First, it helps protect the vessel from tearing, and second, it increases scar formation, which can help the anastomosis heal. The shods are always used. The pledgets are used when necessary. Pledgets typically come in packages of 10, but they are not counted because they're designed to be sewn to tissue. Shods are counted. We use a wide variety of grafts in this specialty to replace diseased blood vessels. These grafts can be synthetic or biological in nature. When used, it's important to remember a few key details. 1, if the graft is synthetic, you must follow manufacturer's guidelines for use. This may mean it needs to soak in saline for a specific period of time, or simply be rinsed off. When using an autograft, the patient will have a vein harvested, and the ST will need to provide necessary instrumentation to prepare the vein to use in the place of an artery. Do you remember the major structural difference between veins and arteries? Veins have valves for the purpose that blood doesn't pool in them, but instead continually makes its way back up towards the heart. The instrument you need to remove the valves in the vein so that it acts like an artery is a valvulotome. In this particular image, it looks like nothing more than a tissue hook like we use in arthroscopy, but the key function of it is the right angle has a blunt tip, and there is a razor sharp edge between that blunt tip and the 90-degree angle bend. The blade will snag a valve and cut through it, and that removes the valves from a vein internally in preparation for a bypass. Know that the most common harvested vein for the purpose of bypass grafts is the saphenous vein in the leg. Another key term for you to learn is bifurcated, which means it's Y-shaped, designed to be implanted into a vessel that branches, like the aorta branches, into iliac arteries. Bifurcated. In addition to complete vessel grafts, there's also a type of vascular graft that is considered a patch graft. On this slide, you'll see how the patch graft is being placed over the specific region of the vessel and how it is initially anchored at the top and bottom of the patch, then sewn with a running vascular stitch all around. The only thing this photo doesn't portray here is that this is that when the surgeon is sewing, they will sew in a circular direction, so be going this way and then going that way with that double-armed suture, and then when they meet, they will be tied together and cut. The suture that is not actively being used will have a rubber shod clamp on it for traction and stability. It's important to note that vascular grafts are very expensive. STs should not request any be opened without first confirming the length and size by the surgeon. Even when 9 times out of 10 they use the same size, there's always that 1 time out of 10 they could use a slightly different graft. Be meticulous about verifying these implants with your circulator. And like I mentioned before, be sure to follow directions regarding the commercially prepared patch grafts, which will ensure a successful graft outcome.